Delegation. Delegation is an essential component of client care and management of nursing units in today's healthcare systems. It does allow managers to maximize the use of their caregivers who are educated at multiple levels, and it also requires a skill set to delegate safely. It is complex. It requires that nurses have a high level of clinical judgment. The goal is to meet the increased demands for services with the decreased resources of healthcare systems. So what I mean by that is that, you know, the cost constraints encourage really the use of less expensive personnel to then maximize the use of the skills of the registered nurse. Nightingale, I mean, we're talking all the way back from, RNs definitely have to learn, all nurses need to learn delegation. They need to have that ability to be able to assign, to supervise, and assist personnel in a safe and effective manner. So the ANA and also the NCSBN, they have a definition and a joint statement related to delegation. Delegation actually started way back with Florence Nightingale, and her statement was that the nurses that she was educating, they needed to look at all these things yourself, but it does not mean that you have to do them yourself. So it's the awareness of what's going on in the environment around you, being able to let others do work that they are trained to do, and then supervising and making sure that those tasks get done. So when we look at delegation and assignment, delegation is the process whereby a nurse directs another healthcare team member to perform specific nursing tasks, procedures, and activities that are beyond the person's traditional role. So you're going to need to know, it goes beyond their traditional role, but and also those tasks that are not routinely performed by that person. So you do need to know what these definitions are and understand what they mean. The NCSBN describes the nursing process as the nurse transferring authority to perform this task, where the ANA, they call this direction a transfer of responsibility. The ANA and also the NCSBN, they both stress that the RN retains accountability for the delegation. When the RN delegates to a licensed nurse, the delegated responsibility must be within the parameters of the scope of practice under which that nurse practice act of the state where the RN is practicing. So you can delegate, but you have to make sure you stay within the scope of practice. So it's important for you to know. We're going to be talking more about the scope of practice throughout the semester, actually. All levels of nursing staff, including RNs, should refuse to accept any task that is outside of their scope of practice. So it is your responsibility, if you're being delegated to do a specific task, that you know that it is within your scope of practice. And also, you should be refusing also to accept tasks that you do not have the expected skills or the knowledge to do that task. Responsibility can be delegated, but accountability can never be delegated. The nursing process cannot be delegated. So the RN is accountable for all clients, all clients' care, whatever they receive, what care they receive. They're responsible for supervising and evaluating of care being provided, and that being that they are supervising that the quality, the appropriateness, and the timeliness is being carried out. Delegated care has to be carried out correctly. So again, supervising when you do delegate a specific task. The assignment is the allocation of tasks that each staff member is already authorized to perform during a given shift. An RN who makes the assignment needs to make sure that there's sufficient time during the shift to complete the assignment. So they're also responsible for monitoring and assessing the staff members' progress toward achieving the task during the shift. So you make the assignment, but you also need to make sure that it is being completed in a timely fashion. Supervision is to provide guidance and oversight of personnel to whom a nursing task was either delegated or assigned. The ANA refers to on-site supervision, and the NCSBM refers to direct supervision. Both require a physical presence and an ongoing direction of the supervising RN. Both also require that the supervising RN be available on site or through various means of written or verbal communication. So for example, in the O'Neill Center, they do not have an RN that is there on a daily basis, but they do have an RN who oversees the nursing process. So supervision can be done in different ways. RNs must also supervise the person they delegate to, ensuring that they meet the standards of care. The responsibility of the RN is to make sure that tasks are carried out safely. In the case of pre-designated lists of tasks for the non-nursing personnel. So you may see or pre-designated lists that are made by the facility, for example, or state boards of nursing. The supervising RN uses evaluation. The evaluation is an assessment of the team member's ability to complete the delegated or assigned task of patient care. It's the art of evaluation requires that the supervising RN, they are able to use direct and indirect observation of how well that staff member is providing safe, high quality, and timely patient care. Having that ongoing, and when we look at direct versus indirect, direct, for example, would be watching an LPN change a dressing, for example. So you've delegated it, you wanted to make sure that they're doing it correctly. Direct observation is something that you would watch them. Indirect observation, you would review the med sheet to see if the meds were given on time. So two different terms there as far as evaluating when you're supervising, when you're the supervising RN. Having an ongoing evaluation, it improves the quality of care and also the communication of that evaluation with those that you're working with. It helps to build a successful team. So at the end of shift, having that evaluation, giving positive feedback versus, you could do positive and also constructive feedback. So positive, giving them credit, give credit to the person who's doing a really good job. So negative evaluation does not need to be harsh, unfeeling, or merciless. You don't need to destroy the person's character and their personality. You can give constructive feedback to help people improve. What you're trying to do is build a team. So when you're supervising, you do not want to put them down to the point they don't feel like they can ever do a good job. Positive reinforcements is beneficial, and developing that nursing team. It's a high quality and functioning unit whenever we have people who feel good about their work and are understanding what it is that they're expected to do. So keep that in mind. You know, you can give people, you can supervise and give positive feedback and constructive criticism. Delegation is restricted to professionals who are licensed and governed by a statutory practice act. RNs cannot delegate certain functions, such as performing admission assessments, developing care plans, and making nursing diagnoses. So you have to know, again, what is within the scope of practice and the expectation of those that you work with. Responsibility and accountability and delegation. The ANA defines delegation as a transfer of responsibility for the performance of an activity from one individual to another while retaining accountability for the outcome. So again, you cannot delegate accountability. Responsibility is the duty of a person as a reasonable and prudent member of a particular group of training by training or licensure to complete tasks and assignments that are within their power, control, and authority. So, for example, if a nurse is working on a surgical unit and dressing changes are a big part of that job, it is the nurse's responsibility to learn to do those dressing changes, the techniques, and to perform them correctly. Responsibility also includes the concept of a person being able to or authorized to take actions or make decisions by themselves, particularly when they're in charge of other individuals, by ensuring that what these persons are doing is correct and safe. So again, another term you need to make sure you understand. Accountability and obligation to be answerable to one's own actions and or the actions of others, particularly where there is assignment or delegation tasks. Although the term accountability is related to responsibility, it has more of an emphasis on oversight. So accountability means the LPN and the supervising RN are held answerable for successfully completing the task. So for example, if they don't complete the task, they need to be able to explain why as well. But for example, vitals are supposed to be done every 2 hours. The LPN is to do it. It doesn't get done. Both are accountable. Okay, so that supervising RN follows up to make sure things get done in a timely manner. But the person who's actually doing the care is also accountable too. Accountability is used to identify who is ultimately answerable for the correct and safe completion of the assignment, as well as who delegated or assigned the task. The term actually does imply that there is an ethical or legal obligation along with the responsibility of legal action or punishment. So there's that implication that goes along with it. Delegatees do not practice on the RN's license. So for example, right now, you do not work on the license of your preceptor. You are accountable for what you have learned in school up until this point. So you're not working on someone else's license, and neither is somebody who that you delegate to. They're not working on your license. When someone accepts a delegated task, they accept the responsibility that's attached to it. They practice on their own license, so if they're LPN, or if they're unlicensed, within their scope of that level of education. So they're accepting that responsibility. So again, remember, when agreeing to accept a delegated task, they are responsible for their own actions and performance of that task. Primary goals of staffing, when we look at the guidelines for delegation, the primary goals of staffing decisions are to make sure that there's optimal staffing patterns that are in place to ensure that we have client safety and high quality client care. It's common for RNs to delegate certain aspects of their care to LPNs, unlicensed assistant personnel, technicians, and other level of ancillary workers. We need to be able to assess the client. So the RN should give careful consideration to the condition of the client and their healthcare needs. They need to assess, is the RN responsible? The assessing is the RN's responsibility. So making sure that the patient that they select to delegate to another person, what is their condition? And then also the person that they're delegating to, do they have the appropriate skills? Patients who are relatively stable are not likely to experience drastic changes in their health status. These are the most suitable for delegation. So again, patients that are stable and are not likely to experience drastic changes in their health status are the most suitable for delegation. Tasks being delegated must be relatively uncomplicated and routine. It must be performed without variation from the policy and procedure and should not require the use of nursing judgment. So example, emptying a Foley catheter and recording output definitely could be delegated. So you delegate what can, delegating what can be delegated to others. That helps with time and the skills of that RN being used more effectively. So you can get more done by using your resources, delegating what you can. Not that you delegate everything, but you have to learn to be able to prioritize and try to get the most use of that time that you do have. So delegation is a task that definitely needs to be mastered. And it takes time to do that. Knowing your staffing abilities, delegating nurse needs to know the availability of the staff and the education and what the competency levels are of the staff. You're going to match those factors with the level of care that's required by the client. And some key information is how often the delegate has performed the required task. So you're asking yourself, are they skilled at, are they going to be able to take care of this patient appropriately? Or have they cared for that type of client? What units have they worked on and feel comfortable in? And their, what are their organizational abilities? So know your staff. Sometimes nurses get pulled from other units. And maybe not necessarily are they comfortable in and taking care of specific kinds of patients. When they, for example, if you get pulled from OB, that was one that occurred often. Well, OB nurses don't necessarily give a lot of medications. Not that they can't. And they may not take care of neurological patients, for example. So just knowing who your staff is and making sure that you are delegating the tasks to somebody who is going to be comfortable and have the skills to care for the types of patients that you're assigning to them. Communication of delegation tasks and any kind of changes. So it's very important to make sure you communicate those delegated tasks, making sure that if there are any changes that you update the staff that you're working with so everyone knows what the expectations are. Also an opportunity to then evaluate where you stand, what's being done, and what needs to be done. Know the job description. The unlicensed assistant personnel. It includes individuals who have been through some training programs. It could be anywhere from a few hours to a few, to several months. So do they have any type of licensure? And therefore, do they have any legal status? No, they don't. So they do not have unlicensed assistant personnel, do not have any type of license. Therefore, they do not have any legal status. So those are the questions you ask yourself. Where do they stand? What is their, what are their abilities? If they're licensed, what are their scope of practice? So think of those kinds of things. The RN must know the institution's official position description for the UAP, as well as their abilities. So you want to know how are they allowed to perform within that unit. The RN needs to know that UAP's competencies and skill levels, or the RN can be held legally liable for any injuries that a patient might suffer if the UAP lacks competence. So part of your assessment is knowing if the person is competent in taking the assignment that was delegated to them, or the task that was delegated to them. When the RN determines that the client needs match the skills and the abilities of the UAP or the LPN, only then should that person be assigned. So you're assessing your those that you work with, along with making decisions on who can best care for that patient. RNs who assign or delegate are also responsible for educating that team member about the task to be done. So if they're unfamiliar with the task, the RN is required to demonstrate how that task or procedure is performed and then document the training. So it's not that you cannot allow them to do it. In order for us to progress forward, we have to teach those that we work with, so then they can gain the skills they need, so you can delegate specific tasks. Education includes telling the team member what is expected in the completion of the task, and when complications, what complications to look for, and also when to report to the RN. The ANA suggests the RN watch the team member perform the designated task at least initially, then make a periodic observation throughout the shift to ensure that they're safe and they're providing competent care for the client. The RN must always be available to answer questions, to help the team member whenever assistance is required. Competencies is something that is, for RNs, for example, is something that's done on an annual basis. And, there are some states, example, California, you must complete competencies and have, and they're not allowed to perform until those competencies are completed. Until that point that they complete those competencies, they're assigned a resource nurse. So if they've not done it, then they have somebody that they can rely on to help them with those particular tasks or skills. Predictable and uncomplicated. The outcome of tasks should be clear and predictable when the task is delegated. So remember, when nurses delegate nursing tasks, they're not delegating nursing. The professional practice of nursing is actually, it's a science. It's based on a unique body of knowledge and an art that is guided by the nursing process. So we do not delegate nursing. So nursing is not just a collection of tasks that we do. It is much bigger than that. So for example, the task that is being delegated to a UAP, so an unlicensed assistant personnel, should not require excessive supervision, complex decision-making, or detailed assessments during its performance. So it should be simplified. Keep that in mind. That can help you make decisions as to what you can and what you cannot delegate. So again, the task that is being delegated to a UAP should not require excessive supervision, complex decision-making, or detailed assessments during its performance. So it's a good thing to have in the back of your mind whenever you're answering NCLEX questions, to run that through your head as to, does it meet this criteria? Mastering the delegation steps, there's 5 rights of delegation. They are an easy way to remember when the RN must they need to consider these whenever you are beginning to delegate. So is it the right task? Do the tasks delegated follow written policy guidelines? The right person, does the person have the proper qualifications for